Viewers, welcome to another episode of Monitor Your Health. My name remains Dr. Femi Ogunremi. You're welcome to the show. Today with me, I have pharmacist Tunde Kikiowo. Obviously, in Nigeria today, we know that, the practice of medicine has moved from one stage to the other. And we know that for our patients, after, treatments, seeing various consultants, various specialists, we have the opportunity of getting, medications, loads and loads of them sometimes. It is very clear to us that sometimes when you have more than one medication that you take together, there's a chance that there might be interaction. We know clearly from some research that some of these medications, if care is not taken, we look through, there might be interaction. Such interaction might do the negative of the work that we expect than the positive, results. So today, to discuss it, we brought into the studio pharmacist Tunde Kikiowo. You're welcome to the show.
Thank you very much, Dr. Femi.
Thank you for your time. Please, can you just introduce yourself to the viewers?
Thank you very much. My name is pharmacist Tunde Kikiowo. I qualified from pharmacy school in Nigeria, and currently I practice in the UK. I work with a lot of doctors and different range of healthcare professionals in supporting our patients get the best out of their medications. And what we do is essentially involves working with our patients to ensure that they get the best and the most out of their medication. There are so many things that we do, but just like Dr. Femi has kindly said, today we will just in a nutshell, just be discussing what a medication use review is all about. So that is me for now. Thank you very much, Dr. Femi.
Thank you so much for that brief introduction. So now, medication review. What do we mean by medication review?
Medication review is a process whereby a patient and a pharmacist sits together and have an in-depth review of the medication that the patient is using. It's an opportunity for the patient to discuss with the pharmacist about the medication they are using, how they are using it, why they are using it, and generally gives the patient the opportunity to ask the pharmacist different questions about their medication. Now, the objective of doing this is to ensure that the patient gets the most out of their medication, to minimize issues of side effects, to discuss with the patient strategies on how the patient can get the best out of the medication that they're using, and as well to ensure that there's reduction of waste, and ultimately to ensure that the patient has the most satisfactory clinical outcomes from the use of their medication. So that is what a medication use review is in a nutshell.
Okay, thank you so much. So obviously, a lot of people will be wondering, why do I really need to get engaged with medication review? When looking at Nigerian clients, I know you're in the UK at the moment, you're practicing there, but you know the system that operates in Nigeria.
Yeah.
We tend to see more of specialists, and specialists at the best of time, they're very busy. They don't have the time to actually sit down and sometimes look at what an individual is taking and things like that. So what then happens is you have one person that is saying like 4 different specialists, they're all doing their own things separately and they have their medications. At what point do a patient start thinking about, oh, I need to do a review of my medication?
Thank you very much, Dr. Femi, for that question. Now, really, as long as a patient is on any medication where the patient is using it for a long period of time, then really over a certain period of time, the patient should really have a review for them of their medication. Now, sometimes what happens is that sometimes our patients are on maybe 4 medication, 4, 5, 6, a lot of cases, we've seen patients on 10, 15, or even sometimes over 20 different items of medications. And they get to see different consultants at different points in time in the patient's journey. Now, it gives rise to things, what we call polypharmacy, which means to say that the patient is on a lot of different medications. Now, polypharmacy will give rise to a lot of problems. Now, there are different types of polypharmacy. There's beneficial polypharmacy and problematic polypharmacy. Problematic polypharmacy is when the patient is on so many medications, whereby maybe, for example, a patient has a particular ailment and then the doctor is prescribing a particular medication for them. They have another problem, they go to see another specialist, and then they have another problem, they see another specialist. Then probably the first problem is getting worse. Then the specialist prescribes another drug with it, and then it goes on and on. Along the line, if the patient now has a scenario where they now start having side effects to a previous drug, that the medication that they're already on. By the time that happens, the patient now starts getting confused because you actually don't know which of the medications is actually causing the problem. And that is where the role of the pharmacist comes in to support the patient in reviewing every one of those medications. Because sometimes it might be that probably what the patient actually has the medication for has already been treated or already been cured. But the patient continues using the medication when the medication should actually have been stopped. So the beauty of the medication use review is that the pharmacist works with the patient, has a critical in-depth review of each of the medications that the patient is having, and then we develop strategies to decide if the patient should actually continue using the medication, or sometimes it might even be that the doses needs to be adjusted, or it might be that there's a need to refer back to the prescriber to review the medication if there's still a continual need for that patient to continue using the medication. So what the pharmacist does is a holistic view of everything the patient is on, and then make the decision in agreement with the patient and the prescriber or the clinician on the strategy to do in order to help the patient get the best out of the whole treatment strategy that the doctor has decided for the patient.
Wow, thank you. So now, who does? I know you talk about the pharmacy. Who does it? Can a doctor not do this? Why can't a doctor do this?
Oh yes, thank you very much. In fact, just today I was going through a journal, a paper, which shows that a lot of times when doctors do a medication review, they are able to do it, but the evidence shows that when a pharmacist works together with a doctor in reviewing a patient's medication, the outcomes are much better. This is scientific evidence-based that shows that a lot of times when you have a scenario where you have a multidisciplinary team involved in the management of the patient, where they all work together, the patient benefits much more out of it. The evidence is quite glaring because, as we all know, the pharmacists are the experts in medicines. However, what we do ultimately is to work with the doctor, work with the prescriber, as it were, to ensure that the patient gets the best out of their medication. I mean, in advanced countries and in a lot of the project works that we've done in Nigeria, as well as all over the world, the evidence is overwhelming to show that when the doctor and the pharmacist work together for the good of the patient at the end of the day benefits the most. There's reduction of wastage. The patient uses their medication much more better. There's that in the sense that there's increase in adherence. Trying to get the right words out now. There's increase and improvement in adherence. That is the way the patient uses the medication. And also, the patient has a better understanding of how to use their medicine in order to get the most out of it. So the evidence is overwhelming that it's better for the patient that the pharmacist and the doctor and other healthcare professionals work together for the betterment or for the improvement of the patient's treatment objectives.
Okay, thank you. So a typical scenario, because some patient or people out there or our viewers will be watching them wondering in their mind,
yes,
how when I come to see a pharmacist
Yes.
for my review,
Yes.
what is it like?
Okay.
For instance, and somebody taking maybe one medication, taking one tablet. I've been taking it for a very long time, and I feel I need to have a review, or maybe even 2 tablets, and I need to have a review. What does it look like? So I come to you as a pharmacist. What are you going to do with me?
So normally what happens is this. We, at the beginning of the consultation, there's a very clear objective of what we want to do. So what we do is that we go through all the medication and discuss with the patient what each medication is used for, what to expect, and if there's certain side effects that happens when the patient uses that particular medication. Now, what we see is that a lot of times when patients have used medications for a long time, especially when there's so many of those medications, patients actually don't know which is used for what. So what the pharmacist does is to help the patient and say that this particular medication is used for this particular ailment or disease state, as it were. And we go through each one of the medications, check with them when they use it, what time of the day they use it, if they're using it in accordance to what the doctor has said that they should use it for, or what time of the day they should use it for, and also how they should use it, if they should use it with food, or if they should not use it with food. You'll be surprised that a lot of medicines that you use, some of them, if you don't use them with food, the effectiveness drops down to as less as 60%. And some medications, if you use them with food, they just don't work. So we go through each one of the medication. If you use it, you use it early in the morning. If you use it later in the day, that sort of thing. And some other things that you could do to enhance the effect of the medication when you use them. So we go through each one of those medications, and also maybe there are problems, the patient is having problem remembering when to use it, things like that. The pharmacist helps the patient with strategies on how to use the medication at the right time of the day. And also, maybe there are certain side effects to look out for, or maybe there are even side effects that the patient doesn't actually know. We go through these things with them and have an in-depth review of what should be done, how the patient should take the medication, and what to actually expect when they're taking the medication. So after we've gone through all that, we also confirm with the patient if they have a good understanding of what we have discussed with them. And from there, we now make the decision, because as you know, the patient is right in the center of everything. And we have to agree with the patient on what is the objective or what we are trying to aim for in the medication use review. And from there, we now have our action points on what to do so that the patient can get the most out of the medication. So in a nutshell, that is how it happens. And at the end of the day, it gives reassurance to the patient on what to do in order to get the best out of the medication, that they are using. Now, there are other types of, there are different types of medication reviews, but on a very basic level, that is what we do with the patient in order to help them get the most out of their medicine. So that is in a nutshell what happens, Dr. Femi.
Thank you so much. And then, these days in this day that COVID is all over the place, people don't want to get out of their houses. People want to get things done at home. And, is there a possibility or is there a chance there that you can actually do this review without somebody coming to the pharmacy?
Exactly. Thank you very much for that, Dr. Femi. Now, it is very possible to do this, and there are different ways by which we could do it as a remote consultation for the patient. Here, all over the world, pharmacists normally do remote consultations in order to help the patient. For example, because of the COVID situation in which we're in, patients don't want to come out, and also it protects both the clinician or the healthcare professional as well. So there are different ways to do it. One of the ways that we can do it is using platforms like AreaDoc, where patients can book a time with a pharmacist or with a doctor to have their medication review. So what they just do is that they could just have a word, and we do it here here in England as well. We do it here in the United Kingdom. And I have colleagues as well that do it in the USA as well, where patients just have a one-to-one, just like the way we're talking now, in a secure, with a secure connection, whereby the pharmacist goes through, the medication with the patient in the comfort of their homes, and just basically discuss their medications with them. And it's just like it happens when we're in clinic as well. These things are very much possible using remote platforms like the AreaDoc telemedicine app as well. Thank you.
Thank you so much. As we round up this session, I think we've gotten the details of this. So medication review, or medicines use review, or use of medicine review. I don't know if you are using some more detailed description of this. Seems to be a very important thing. And to the viewers, wherever you are, I think I intentionally brought a pharmacist here to talk us through this, because there are so many people that suffer from the side effects, or maybe from an interaction from the medications they're taking. And I believe that throwing light into this will make it will just share some things in your heart, so that if you know you're taking more than one medication, or even one, sometimes you might even need to have blood tests or things like that to actually check and make sure that things are okay, and you're getting the result that you want from your medication. It's good for you to discuss this with your doctors. And also, if you need any help, obviously, like Pharmacist Tunde has said, AreaDoc app is there. You can download it, and then you can book appointment with pharmacists. They'll be able to do this for you remotely, and then we can see how we can actually help in making your care to be safe for you. And then we don't make mistake by virtue of us not doing what we're supposed to do because we do not know it. So thank you so much for coming today, Pharmacist Tunde Kikiowo. We really appreciate your time. I know it's a long shot, because we call you at a very short time when you are quite busy. For you to squeeze this time after your work, we really appreciate it. Thank you. So do you have the last word you want to either encourage the government or individual in Nigeria as it stands?
Yes, I think. Thank you very much for that question. For saying that, Dr. Femi. It's very important that as a healthcare system, that doctors, pharmacists, and all other healthcare professionals, nurses, dietitians, podiatrists, and all the different categories of healthcare professionals are able to work together. For the good of the patient. And I think there was something else that I just wanted to add. When it comes to the issue of medication use reviews, the category of patients that could have it are patients that have long-term conditions, diabetics, hypertension, or even people who are on combination of myriad of painkillers, opioid addictive medications, patients with comorbidities, that is, different disease states happening at the same time. This group of patients can ideally benefit from medication use reviews. The other thing as well is that a lot of the work we are doing involves working with the governments to ensure that there's increased access to healthcare professionals who can be able to do this for the health of the whole of the population healthcare system, as it were. So it's important that this synergistic working between different groups of healthcare professionals are encouraged for the good of the individual patient, and also for large population groups, and for also the healthcare system of a whole country. Everybody wins at the end of the day, and the health of our people will become better as a result of the whole thing. So thank you very much, Dr. Femi.
Thank you so much for making it, and we really appreciate you. And to the viewers, thank you. It's a short one, and I think it's a sharp one, and I believe we've learned from this. Have a good day, and have the best of the week. Bye-bye.